a short time ago, announced he is asking that there be no gatherings bigger than 10 people, and restaurants and bars should close. We're really still trying to digest what that really means for our community. Since this is a new development, we will discuss what Orange County's plan is moving forward. We will update you in the very near future, and we must have conversations with other local governments and private business owners to come up with a plan that really works best for all of us. I still advocate for our residents limiting their exposure by practicing good hygiene and social distancing. And now let me review a few developments in county operations with you. At our parks, our gyms have been closed and our splash pads have been shut down. Although we canceled non-essential county meetings and programs, our spring camps are still in operation. We have 11 sites with about 20 children per camp. At this point, we are making sure the children are safe in sanitary environments, and we have parents filling out questionnaires every day to ensure that there are no changes in the health of their children. We're also using medical screenings at these particular facilities. In other words, we will be checking for the temperatures of those who will be entering those premises. Our History Center has been closed to the public for a thorough cleaning until further notice. At Orange County Administration, our permitting services is now requiring that all new permits be submitted through our fast-track online services portal. We ask our customers to please consider submitting permits online. Our crisis assistance team stands ready to work with families in need. We are making sure families are able to remain stable during this health care crisis. Our Orange County Utilities has suspended water service disconnection due to non-payment through the end of this month. The department recognizes the financial hardship some residents are facing as businesses close because of COVID-19. Many of our employees have been affected due to the cancellations at the convention center. In all, there are 472 regular workers, and they will continue to be paid and continue to work. We have alternative work that we will be requiring or asking them to do at our convention center. In addition, we have dozens of seasonal workers who are seeing their hours decrease. We want all of these convention center workers to know that we have a plan to provide work to the seasonal staff. Many of the conventions that did not occur this month are being rescheduled for the summer, and we anticipate a very busy time this summer. In addition, we are concerned about our community at large. We will be utilizing existing Orange County crisis assistance programs to provide immediate financial assistance to residents while waiting for federal and state funds to become available. More details about that will be forthcoming. At this time, I'm going to ask Dr. Pino to come forward to give us an update from the State Department of Health at Orange County. Dr. Pino.
Thank you, Mayor. Raul Pino, Health Officer for Orange County. We have some new developments that I will go into details with regard to the cases, but I want to emphasize first that where we are right now in how the epidemic is developing in our county is critical to how we are going to see this developing 2 weeks from now. So it's critical and important that we follow all the advice given by authorities, that we diminish the number of outings and contacts that we have face-to-face in large crowds and with individuals that we have no control over, that we don't know who they are, where they have been. So that's why we try to keep it now at 10, because most likely you will be people that you know who they are, where they are coming from, and we can establish a connection if we need to do some disease investigation in the future. But if you are in a large crowd of 100, it will be very difficult to monitor that kind of activity and to diminish the contacts that we are establishing with some individuals. With regard to the number of cases, we have 4 cases confirmed in the county. Those are the 2 that we have initially mentioned it to you. Also the female that died in California that never was in our county. And then we have a person who passed away in one of our facilities here in Orlando over the weekend, and it was determined that the individual had coronavirus. We are conducting the 2 individuals that are alive at this point and in very good health in their homes. They are self-quarantined with family members. And as a precautionary step, we also decided to test all the family members in those 2 clusters just to prevent anything else from happening. But again, that was done out of the extreme caution of having a head start in the steps ahead that we are going to need. The department is also ready to increase testing when we receive the resources coming from the state on that regard. And we also prepare with the help of our county government to conduct drive-through testing if the need arises in our community. With that, thank you.
Okay, let me ask our Chief Judge here in the 9th Judicial Circuit, Judge Myers, to come forward and share with you some of the developments as it relates to our courts. Judge Myers.
Thank you, Mayor. Good afternoon. I want our viewers and listeners to know that the first priority in the court system are people. And we want to ensure the safety and well-being of the people that work in the courthouse and the people that use the courthouse services. So my message is for litigants, for lawyers, for witnesses, for potential jurors, anybody that might be headed toward the courthouse. Last Friday, the Supreme Court entered an administrative order suspending all jury trials, jury summonses for the next 2 weeks. And so we will not be conducting any jury trials or summonsing any more jurors to come into the courthouse for the next 2 weeks. In addition, because of the limitations that the CDC has now imposed, we recognize that many of the events that we conduct inside of the courthouse require gatherings that sometimes are in excess of 50 and certainly in excess of 10. As a result, effective tomorrow morning, we will be limiting courthouse access for only essential hearings and functions. What that means is that most hearings will be handled through technology, either video conferencing or teleconferencing, where the litigants and lawyers are able to access those resources. In the event they are not, those proceedings will be canceled or postponed, and we will reschedule or reset those things. In addition, we will conduct all of our regular business at the jail, at the booking and reception center, and I anticipate that we will do all of that through electronic means as well. So initial appearances, urgent matters that must be addressed by the court under the Constitution will continue as normal, and we'll proceed with those at the BRC. We will continue to communicate with our community through social media at 9th Circuit FL. Encourage you to follow us there. That's where our most recent updates are. There should be a release posted at this time, and all of our proceedings at this point will be communicated through social media and in these contexts to you so that you can follow. The most important thing to recognize for us is that the people who come to the courthouse will be safe. And so we will continue to minimize any gathering opportunities, whether that be in security lines, in elevators, or in courtrooms, to ensure that the people who come to visit us are safe. Thank you, Mayor.
All right. Thank you, Judge. At this time, I'm going to ask Dr. Yolanda Martinez from the Orange County Health Services to come forward, and then we will proceed with the remainder of our speakers.
Thank you, Mayor. Good afternoon. The Health Services Department at Orange County, as I've mentioned before, is working very closely with the Department of Health, and we're providing as much support as Dr. Pino and his team might need from county services and the county government. And we've said it before. I don't think we say it enough nowadays, but we continue to stress the importance of social distancing, hand washing, covering your mouth when you cough or sneeze, and staying home if you feel sick. Of course, that preludes if you have to go to the doctor or the emergency room. But these strategies have proven to be the ones that can prevent the coronavirus from spreading. We continue to stress that those that are most vulnerable to this disease are the elderly, and the people with compromised immune systems. So for us personally, we need to be very conscientious of that. We need to be conscientious of those around us, our family, our friends, and our neighbors. As the number of COVID-19 cases continue to increase in Florida, it is most important now than ever to be prudent with our behavior and our actions as we protect ourselves and protect others. If you think you might have been exposed to COVID-19 or have symptoms of fever, cough, shortness of breath, or you feel that you need to go to your doctor or the emergency room, it is imperative, and I repeat, it is imperative that you call ahead of time. You call your doctor's office if you feel that you have any of the symptoms or might have been exposed to COVID-19, and you let them know that that is the reason why you're coming to their office. If you're going to the emergency room, it is imperative that you let them know ahead of time that you are coming because of this reason. And the main reason for this is not that they don't want to see you, they don't want to help you. Obviously, that's what they're there for, that's what they want to do, but they need to prepare their rooms and their staff to be able to receive you so that they don't get contaminated if you happen to have the virus. Also, they need to protect those who are in the waiting rooms, waiting to be seen for other reasons that might not be COVID-19. So we can repeat it 100 times, but everybody needs to understand that it is imperative that if you're going to your doctor because you feel that you have COVID-19, that you've been exposed, that you have a cough, that you have a fever, that you call ahead of time and let them know that you need to see them, that you're coming, that you need to come, and they will expect you and be prepared for you. Some of the numbers that I will share with you will help you address that information. These are the vehicles that have been provided to us. The Florida Department of Health, the number is 1-866-779-6121. That's the state number. Advent Health also has a website and has a phone number, and I've tested them all this morning, so they all work. 1-877-847-8747. Again, that's for Advent Health. Orlando Health also has a website, www.orlandohealth.com/COVID-19. So again, this is the time that we need to be vigilant. I've mentioned before that fortunately for the majority of us, unfortunately for 4 individuals and 2 of them that have passed, the disease has visited our county, but we have had time to prepare. Let's continue to be vigilant. Let's continue to be prudent. Let's continue to prepare, take care of ourselves, take care of our loved ones, and take care of our families and our neighbors. And with that, I'd like to pass it over to Sheriff Mina.
Thank you and good afternoon. The safety and well-being of our residents and visitors is our top priority at the Orange County Sheriff's Office. Our deputies are responding to calls for service. We have adequate resources to keep them safe and protected. And as I said before, they're trained to deal with a variety of contagions and follow specific protocols in those instances. Our enforcement actions and protocols have not changed, but because of the state of emergency related to coronavirus, we have temporarily suspended all eviction activities until further notice. And also following the CDC guidelines, we have canceled most of our public events to include citizens police academies, community barbecues, and the like. So we're asking that whenever possible, people file reports online, and they can go to OCSO.com. So most reports that obviously are calls that are not in progress, identity thefts, and stolen tags and the like can be reported online at OCSO.com. And most of our school resource deputies will fill other roles within the agency while schools are closed. So that means additional deputies will be out on the streets, and we're going to continue to pay our school crossing guards while school is closed. And so, again, we're all in this together, and Orange County Sheriff's Office stands ready to help our community out. Thanks. So this time I'd like to introduce Phil Brown, Executive Director of the Orlando International Airport.
Thank you, Sheriff Mina. Good afternoon. Let me begin by saying that I know how taxing this public health event is on the traveling public and the employees at Orlando International Airport and Orlando Executive Airport. It's our employees that help us deliver the service and the experience, the Orlando experience, and I can't thank them enough for their continued service and dedication. With that said, I do have some updates I can provide you about the operations at Orlando International Airport. Today is the last day of normal operations for flights to and from the United Kingdom and Ireland and Orlando International Airport. As you've heard, the federal travel ban has been expanded last week from the list of the Schengen countries, the European Union, and the new limitation goes into effect tonight. Excuse me. It's just a cough. British Airways, Virgin Atlantic, Aer Lingus, and Norwegian maintain today's scheduled operations. We have not seen an influx in passengers coming to the main terminal hoping to alter their flight schedules. Virgin Atlantic has obtained approval to offer 3 outbound flights on both Tuesday, March 17th and Wednesday, March 18th. Those are going to be coming in empty with crews, and they'll ferry passengers out that need to go back to the UK. Airport concessionaires to continue to provide critical services to the traveling public. It's possible that operational hours that will be reduced as we start to see a downturn in the traffic. And food vendors may change as a result, change their hours as a result of passenger demand and airport traffic. And there may be some closure of selected operations as the volume decreases. As always, the Greater Orlando Aviation Authority leadership maintains a deep commitment to continuing enhanced cleaning within the main terminal buildings and in the airsides. We have also continued our routine updates with local, state, and federal public officials to ensure the safety of everyone within our world-class facilities. So we have security on site, Orlando Police Department. We're continuing extensive cleaning. Those of you that go to the airport will see that we have lanes separated. We're not using all the lanes, and we're keeping social distancing to the extent we can. We're working closely with Transportation Security Administration to maintain that in the checkpoint. So with that, I would like to turn it over to Supervisor of Election Bill Cowles.
Thank you, and good afternoon. We are also very concerned about the citizens, the poll workers, and the voters who will participate in tomorrow's election. Let me start first by saying that, yes, we know the report that Louisiana governor postponed their presidential preference primary, and late this afternoon I came out of a meeting to find out that the Ohio governor is considering doing that. Here in Florida, only the governor, Governor DeSantis, has the ability under the state constitution to change an election. And at this point, I have not heard anything from the governor's office or the Florida Department of State Division of Elections concerning any change to the schedule to have the Florida presidential preference primary election. And here in Orange County, we have 6 elections tomorrow for 6 of our cities. The next part would be that, early voting is done. There is no early voting as of Sunday night. Vote by mail for voters concerned about their ballots. They can still deliver them to the elections office in our main office on Cayley Street. It's not too late to come in today, and we're still there to get a ballot. But there is a thing in Florida law called the designee, and tomorrow it's called the emergency ballot, and that is where a person can come in with a document that has the designation of somebody to pick up a ballot for them. So if there's a citizen who doesn't feel comfortable going out and going to the polls tomorrow, if they get the document, bring it to us. We will then be able to issue a ballot and then take it back to the individual to vote and have the ballot brought back to the office. But all voting ends at 7 p.m. on Tuesday night. So the next part is tomorrow morning, 7 a.m., polling places. 247 polling places will open for voting. Last week, based on the executive order for assisted living facilities, we changed the polling place for precinct 431 from Summerby Lake Nona, which is an assisted living facility, and moved it up to Orlando Fire Station number 16. So with a time frame, the city of Orlando did calls to the citizens in that area for us. We had a scout troop go out and put door hangers out this weekend to let them know. It's on our social media, our website for that change. Also, late this afternoon while we were delivering voting equipment to the 247 polling places. The Starlight Ranch over on Pershing Avenue said that we could not use the facility, and their corporate office concurred, and so we had to move that polling place. That's Precinct 322. Precinct 322 will be moved over to the VFW post on 3500 South Goldenrod Road. So we're working to get the message out. We appreciate the help in getting the message to those voters. At each of the sites that have changed, there will be a person there who can direct them to the right location for the voting. You've heard in prior conferences that the City of Orlando and Orange County have suspended programs at their senior centers or community centers. But we do have an agreement with both the city and the counties for those facilities. Even though they may be closed currently, they are open for the election tomorrow. For our poll workers, we have provided them with limited amount of supplies so that they can wipe down the counters, the tablets, and even as some of you have asked me about pens, they can bring their own pen to mark their ballot as well. At it, but we're trying to keep the polling place as clean as possible. Voters can bring anything they would like. If they want to wipe down the voting booth before they mark their ballot, that's fine. If they feel like they need to wear a mask, they can do that. We've had some already in early voting. So we're doing everything we can to make sure the environment is clean for those voters on Election Day. Most of this information is posted on our website, ocfelections.com. And with that, back to the mayor.
Okay, thank you. While they did not speak, let me also just acknowledge the comptroller, Phil Diamond, is here. We have the tax collector, Mr. Scott Randolph, and we have the property appraiser, Mr. Rick Singh, who are here. I, at this time, will open it up for any questions that you may have for any of the representatives here today.
Can you tell us about the person who died over the weekend?
I'm sorry.
Can you tell us about the person who died over the weekend?
Dr. Pino would have the more direct information.
What would you like to know?
What can you tell us about this person?
Little. So he's 70 years old, 79 years old, female, with previous health conditions, serious health conditions, who was initially admitted with not this diagnosis, but because she developed lower respiratory diseases, was tested for it, and it was determined that it was COVID-19.
So she didn't have anything?
No, she did have symptoms, but it wasn't, it's not clear. We are still investigating where she may have acquired, so it wasn't a straight link that was visible at the initial questions that the CDC has designed. So in her questionnaire, when she was screened, it was not a right answer for any of the three elements there. Meaning, we don't know, she never expressed that she has traveled outside the country or any of the areas, and we do not know a known contact with anyone who was positive. So in that regard, we don't know where she may have acquired.
Was she on your living home?
I don't know.
Was she ever put in isolation?
I don't know.
Dr. Pino, you said on Friday you had the ability to test 50 people. What is the ability to test right now? How many people can you test?
So what I said last week was that the Department of Health was authorizing about up to 5 tests a day for those cases that meet the CDC criteria. So about 5 times a day we were seeing people who may have traveled to some of the areas that are being affected by this outside the country, or people who may have been in contact with someone that was diagnosed. Now, the clinical settings do have capacity that is out of our control, that we don't have a real measure. For that, you will have to call them, because we only get notified if a case becomes positive. So we have no knowledge of how many people they are testing a day. If we were to be fully operated in the facility that we have fitted for this purpose, we could do 50 a day for people that come through the criteria. We are expecting the criteria to be expanded, and we received information this morning about new categories. I haven't had the time to digest it and read it, but as the criteria get expanded, more people will be tested. For that, we are waiting for additional supplies from the state to be able to fulfill that commitment.
And are we getting closer to a drive-through testing?
We are ready to do a drive-through testing. We always, we have regular pads, exercise. We recently did one university high school on flu, I believe, in September, October. And we can do those. We can stand a pod in 24 hours. That's not the issue. The issue is when you have a pod and you don't know how many people are going to show up, you have to have enough supply to offer services to anyone who may show up in the line. So that's our concern in that regard. We have to have sufficient supply because you cannot open a pod, get 300 people, and only have supply for 50. That would be...
I mean, people were outraged when they saw what it looked like at Disney last night. Thousands of people packed in there. It's going to look like that for St. Patrick's Day if we don't close the bars and the restaurants. Why are you not ready to make that call yet when other states and cities have?
Again, here locally, we will have conversations with the other local governments so that we have a consistent response to it. Just prior to this meeting, we heard the recommendations by the President and the federal government, and we'll certainly digest that. But more than likely, after we have the opportunity to deliberate over this, you're going to see some directive, and we will do that as quickly as we can. We will err on the side of safety and making those types of determinations, and that is something that will come very soon.
Do you plan to make that call before St. Patrick's Day celebrations?
There's no question that we'll make that call before then, and we'll make it in the best interest of trying to have a positive impact on the spread of the virus throughout our community.
Mayor, I know the supervisor election said that only the governor can postpone a presidential primary. Do you think it's safe to vote tomorrow?
Given what I heard the supervisor of elections say, I believe that he's taken all the appropriate measures to ensure that the voting booths as well as the voting locations will be clean and sanitized. And I, again, believe that if individuals practice the CDC guidelines, that it should be a safe environment for them to be able to go and to vote.
Mayor, the Office of Emergency Management in Seminole County has voiced frustration from when they feel they receive numbers from Tallahassee versus the lapse in time between when those numbers are made public. Have you experienced any of that in Orange County?
I'm going to assume that you're referencing when they are notified about positive developments, when individuals test positive. Yes, we have frustration there. Many times we receive the information from the media, and while we work very closely with Dr. Pino, who represents the Florida Department of Health, these are things that are outside of his control, and sometimes it's not a good, efficient way to make notifications. So I have talked to the state's Surgeon General, who has said that they will endeavor to improve upon the communication with local governments. Of course, this is a pandemic that certainly hits us at the local level very hard. And so we're just trying to all work in good partnership with one another to have good communication. So I look forward to that improving, quite frankly.
Specific concern with this lapse?
Well, in order for us to respond appropriately to the emerging needs of our community based on what is happening here real time, we have to have that information. We are part of the system, if you will, the system of care and prevention that we are trying to institute throughout the country and certainly within each state and in our local communities. And that's why you have seen us on a number of occasions take leadership roles here at the local level to do what we are really entrusted to do for our citizens. And I'm going to continue to do that.
This question is for either the mayor or Dr. Pino or Dr. Martinez. Have you been in contact with the hospitals and asked them to share how many tests they've given, how many tests they've done?
Well, I think we all can provide some response to that, but we had a conference call earlier today, and there were representatives of the major hospitals that were a part of that conference call. Again, we want to try to make certain that we have good communications, and they share the information that they can without violating any of the HIPAA laws, et cetera. Because Dr. Pino is a medical doctor and part of the statewide system, he has the ability to talk as a medical doctor directly with them. And so I'll ask him to come forward and kind of opine on anything else.
Yes, we talk to them constantly, and they know our numbers. We are in texting basis with the leadership in many of the infectious disease areas in the hospital. We do not ask the questions that we don't need to know, and we do it because we don't want to tax their resources. Every time that I ask for data, if I don't need it, someone will have to go and do the work and have that data ready for us. So right now, the only obligation legally is to report any positive. But if we were concerned about the number of tests that are negative, we can get that information rather quick. It's not an issue.
Doctor, we're hearing that there may be 5 positive cases at one of the Orlando hospitals. Is it possible that they have positive cases that you don't know about yet? And what is the lag time in those cases?
So that is possible. The way that the system is working right now is, again, as soon as they get a positive, we will be notified. Who they notify? They notify my AP department. That AP department shared that information rather quick with the state, and we try to triangulate the data. In many cases, the CDC is requesting for a second sample to be sent to a state lab so that it gets, that's what we call the confirmation. And then when it's confirmed, it's one that is released to the press and to the public. Only those cases that are confirmed. So it's possible there are 3 cases, 4 cases waiting to be confirmed, and we will learn on a later date.
Any suspected cases like that in the Orlando, Orange County area?
Yes.
Can you say how many?
No.
Doctor, can you confirm last night the Department of Health sent out a memo to physicians letting them know that the previous guidelines to adhere to for testing no longer apply, and for doctors to use their own discretion in order to conduct a test for COVID-19?
So the commercial labs can do testing on a doctor's notice and doesn't have to adhere necessarily to any of the CDC guidelines. So a doctor, since probably last week, have the discretion, since commercial labs have started to provide those services. We always advise, due to the initial lack of testing ability, to restrain those to the number of choices given by the CDC, so that we concentrate on those cases that more likely would be positive, because those are the cases that we needed to learn right away. Now that in many areas of the country there is a community distribution of the disease, now what is important is to find any positive that are out in the community, because when you have community distribution, that link to a previous positive case may not work. Like could be the case of this person that unfortunately passed away last night, yesterday in one of our hospitals. So yes, that could happen.
So you can confirm a memo did go out stating what you are describing?
I don't know about the memo. I know about my memo, and I received a memo that changed the guidelines.
Chief Judge, if you wouldn't mind answering a question. We've received some information that you might be letting minor offenders go without court dates. Is that the case, or?
No, that's not accurate. We're bound to follow the law, and we'll continue to, I know law enforcement will continue to take appropriate action to take juveniles into custody if that's necessary. We are set up to conduct hearings with our juveniles, and for those juveniles that are appropriate to be held, they'll be held, and for those that are appropriate to be released, they'll be released. Thank you.
Bill Brown. Regarding the TSA agent that tested positive, our passengers, were they at risk? If so, were they contacted? Should we be worried if we were there that same day?
There have been investigations that are ongoing. I don't know the details of it. What we've done is increase the cleaning in all of the checkpoints, as well as on employee buses in any areas to minimize that. So there's been no information provided to us about the origin of the contagion for the TSA officer.
Should we be concerned about that no information has been given to us?
Well, that information is subject to HIPAA, so there's no information that I can give you. All I can do is take care of the cleaning and make sure that the areas in which she worked, which is one specific area, have been cleaned and they continue to be cleaned.
So is there any way to contact passengers that may have been going through there?
That investigation is ongoing with the TSA.
Mr. Brown, has Orlando International been a part of the dialogue with a group of airports that are reported to be asking for nearly $10 billion in bailouts from Congress?
Yes.
Explain the specific concerns you're having right now as you stand here, as you look towards the future of what Orlando International might face.
What we're looking at is an unprecedented downturn in traffic. We all have obligations, in particular debt service obligations for bondholders. So the group of airports that is working on that and working with members of Congress is looking for the ability to receive some portion of that back so that we can make sure that we maintain our debt service payments.
Mayor, just again on the restaurants and bars, if the decision's not made to close them, what do you want people to know before they go out the door tomorrow?
What I want the public here in Orange County to know is that we'll make an appropriate decision to err on the side of safety for everyone, and how when we make announcements, it has to be an orderly process, and we have to be very specific. You know, when we get a very specific response, we want to give a very specific answer to any questions that small business owners may ask us. We are doing some things, as I indicated, here within Orange County to try to mitigate any financial impact on our residents. We are depending on additional resources to flow from the federal government and to the state to help support some of our small businesses. And at this point, that is something that is undefined. So if we make any decisions to recommend that businesses be closed, we want to do that with an abundance of caution on their behalf as well as the public at large. And so we'll continue to make those decisions quickly, you know, but again, the press event that was announced earlier just occurred immediately prior to this press event. So I haven't had the time to really understand and digest the information that was put out today, but we will.
One more question, anybody? Are we good?
Okay. Thank you all for being here.